When you are stressed out, dental assistants, it sucks the air out of the room. I spent about 3,000 hours studying what causes burnout and chronic exhaustion. One thing I've learned is that we can't control anybody. We bring our life into the office, but it takes a lot of self-awareness to be others absorbed and not self-absorbed. Even though you may not be the labeled leader as a vertical, there is horizontal leadership. You can set the culture and the tone of your practice, even if vertically those around you may not be doing a good job. I can guarantee if you spend a little time with your patients, there's some very powerful experiences that can build us up.
Hey everybody, welcome back into another edition of the Dental Assistant Nation podcast. My name is Kevin Henry, founder of Dental Assistant Nation. So glad you've joined us. This is a really important episode, and I'm really glad to have on somebody that's very passionate about the topic we're going to talk about today. And that's Dr. Eric Johnson. Dr. Johnson, how are you today?
Oh, excellent. Good to be here this morning.
Hey, so glad you're joining us. We're going to talk a lot about the stress in the dental practice, particularly with the dentist, and what dental assistants need to know about that. And Dr. Johnson has just recorded a podcast with me for drbicuspid.com, where he really went in depth on what to look for with the dentist and how to help with stress and burnout. And Dr. Johnson, I know that this is something that you're very passionate about because it's something you experienced yourself.
Yeah, about 9 years ago, the accumulation of stress built up to where I went through a dark season myself. And as a result, it was such a meaningful experience. I went and got a doctorate in leadership. And I spent about 3,000 hours, Kevin, studying what causes burnout and chronic exhaustion, what are the implications, but more importantly, using resources and studying that from engaged dentists and teams. What resources do we have, Kevin, to mitigate it and find meaning in dentistry again? And it's been a significant impact in my life.
Well, I'm glad that you're out there and we're talking about something that so often I think gets pushed to the side. So let's start 30,000 foot view. What do dental assistants need to know about what's going on in their dentist's mind right now and maybe how they can help him or her through this time?
Sure, that's a great question, Kevin. You know, one thing I've learned is that we can't control anybody. And so you can be around, we assume that the dentist is the leader and the leader has it all together, but that's not the reality because I can speak from firsthand experience. And so knowing that we're in a culture that sometimes the top-down leaders don't have it together, what do we do as somebody who's in that culture? And so what I want to do is, first of all, I just want to thank all of the assistants that are out there that make the culture what it is, and the hard work and day in and day out that the assistants offer not only to the practice but to the patients. Kevin, I'll give you an example that happened this week, okay?
Okay.
So we had all the chairs in our operatory in our office full. I was doing a new patient consultation on cosmetics, and my assistant comes running in and says, "I need you right now."
Hmm.
So I'm in this introduction. There's a lot going on, a lot of questions. Kevin, I'm telling you, 18 years of dentistry, I walk in and my dental assistant had a PVS suppression stuck on the lower arch of a geriatric patient, and they could not get it out. And instantly, I had to decide, what was I going to do?
Mm-hmm.
Was I going to get upset? Was I going to, in that operatory? And I realized I needed to support my assistant and I needed to support my patient.
Mm-hmm.
We literally had to cut that tray out of that patient's mouth with a burr.
Wow.
And my dental assistant was so upset and was expecting me to explode. And we had a good hour conversation about that. And I said, you guys, there's a lot of work, what you guys do day in and day out. And I said, the way you managed your patient, the way you managed the conversation with me, you were calm, you were in order. And I said, let's go back to some of the basic things. And Kevin, do we have time? I'd like to share that with you.
Please.
So in my training and with my dentists and teams, we talk about CPR. And so There's CPR when it comes to energy. When you are stressed out, dental assistants, it sucks the air out of the room.
Yep.
And so I want to give you guys, and this is what happened that day with my assistant when that tray got stuck, is we did CPR. And the acronym is easy to remember because we do it for resuscitation, but C stands for communicate and anticipate.
Okay.
So dental assistants, hygienists, front office, yeah, even though you may not be the labeled leader as a vertical, there is horizontal leadership. You can set the culture and the tone of your practice, even if vertically those around you may not be doing a good job. Okay. So communicate and anticipate. Anticipate the schedule, anticipate the clusters, anticipate the difficult patients, anticipate the difficult conversations we may have with financials, anticipate when you know you're in a treatment and there's 30 minutes left of that treatment and that patient's 5 minutes away from being scheduled. Anticipate and communicate huddles and mini huddles. Like have conversations during the day, and we do that. We're like, we're really behind. I need to talk. So we huddle in the hallway. Who's got this? Who's got room set? Okay, what are we gonna do? Okay, I'll see you guys in an hour. Okay. And that really decreases a lot of the anxiety, Kevin, when we communicate and we anticipate. And sometimes having a conversation, the right conversation, but it needs to be done at the right time. And there is a wrong time. So asking for time off, talking about a leave of absence may not be the right time when there's a lot of conflict, a lot of stress in the office.
Yeah, absolutely.
P, professionalism.
I like
So when there is stress, I'm just going to encourage us to take a deep breath and consistently to act professional. Ask questions on how can I help? Try to avoid gossip
Mm.
and backbiting.
Yep.
And try to stop blaming front and back office and blaming the other assistant or the hygienist, and be professional and with empathy and to ask open-ended questions of like, Kevin, what can I do? I mean, that was really hard I know it was really hard to get that tray out. How can I help you? How can we recover on that?
Yeah.
And that's what the R is. So R is recover.
I like that.
Man, I'm telling you what, you don't think that assistant was stressed and she was embarrassed and learned a lot. And when that patient, and by the time we got that tray out, the way that she handled herself, my assistant, my patient got up and she hugged us both.
Hmm.
And I knew exactly that we maintained composure, we maintained professionalism during that experience, but she needed to recover. And I told her to go take a little walk. And those little walks at lunchtime, take a break, go in the break room, get some water. Hygienist, take a break between your patients. I'm encouraging instead of every 60 minute, maybe do 50 minutes. It take 10 minutes to recover. And maybe make a quick phone call and have something where you're able to reconnect and cut the cord of that energy. So I hope CPR is a good an acronym for you.
It's a great acronym, and it's one that I think would benefit so many dental practices. And I guess one thing that I'm sure our audience is thinking right now is if we want to try to put the CPR mindset into a practice that maybe doesn't have it, how does an assistant bring that up with the doctor? Or how do we bring that up whenever, like you said, we may often think about top down leadership, but often it's a horizontal leadership that should be
Yeah.
happening?
Number one, you can't change anybody. And there's the right conversation at the right time. So if you bring up CPR, there's a time to bring that up.
Hmm.
Okay. And it's not in the peak of stress. But once you get through this, there's this whole process of a group forming, and then you have storming, and then you have norming, and then you have performing. It's this transition where challenges make groups come together so you work more proficiently and efficiently with high performance. But there's a time to get through that. And part of that is finding maybe another person in your office where you can actually start expressing this. Like, you know what? I'm going to anticipate and I'm going to communicate. I see the schedule. I'm going to take the lead on making sure that all the schedule is managed and the schedule is not managing us. So you're finding maybe somebody horizontally, maybe another peer,
Hmm.
where you guys collectively team up and create a culture together where you guys stay professional and you're communicating and you're articulating and you're like, hey, did you restore after the last procedure? Can I take this next patient for you? so that you can actually take a break and maybe do something that's numbing so that your brain could just deprocess that.
Yeah.
So maybe find somebody in your office
Okay.
that you can actually connect with, and then find the right time where you talk with your office director and manager and the dentist.
So if we sense that that stress is coming from the dentist and we stress it's a bad day or it's been a bad week or whatever it is, what do you think the dental assistant's role is kind of maybe alleviating some of that stress? Is it as simple as just letting them know you're there for them? Is it backing off? What do you see as some of the solutions that may help in that scenario?
Kevin, great question. I think dental assistants can be co-pilots and not passengers.
Yep.
So if you want to be a co-pilot, you're in the front cockpit with the dentist and you support them. The rooms are set up. Everything is ready and lined up. You're asking questions on how can I help? You're giving positive energy. We're not sighing when the treatment runs late. You're patient. You're asking questions on, you're acknowledging, you're aware of the schedule. And so that's a co-pilot versus a passenger who sits back and waits for us to get to our destination, which could be a completion of treatment.
And one thing that I hear from dental assistants so often is that something may happen on the way into work, something may happen before they get into work, and separating the stress that they felt before they walked into the practice with what they need to do in the practice is sometimes a tough thing. How do you work with that in your practice as well?
We have a saying in our office that we keep our stuff at the door. So that's where the professionalism comes in for the CPR, is that we got to keep our personal life at the door. But it's really hard to come in and skipping and hopping, and I don't expect that. Kevin, to be honest, there are days I come to the office and I'm not feeling great on the inside. But I tell you what, when you're around good people, by 9:30, Kevin, I'm pretty elevated. I pay attention to my patients, I pay attention to my team, and all of a sudden, I'm feeling pretty good.
Nice.
And so I want to tell the dental assistants that, you don't have to hop and skip. You don't have to always be on the high, but do keep your stuff at the door. And then once you're there, you show up and be professional, but maybe spend a little bit of time looking around you and looking what's good. Look at the other team members and what they got going on. And sometimes you draw from their strength. And I can guarantee if you spend a little time with your patients, there's some very powerful experiences that can build us up. So, yeah, I mean, we bring our life into the office, but it takes a lot of self awareness to be others absorbed and not self absorbed.
Love that. And last point I want to bring up with you is one of the things that you and I talked about on the Doctor Bicuspid podcast is how it's okay to say I'm burned out. It's okay to say I'm stressed. It's okay for dental assistants to say that, correct?
Yeah.
Yeah.
Yeah. It's okay not to be okay.
Okay.
And to realize you're not alone. And dental assistants, nobody understands a dental assistant like another dental assistant. My recommendation is find a community and find an organization, whether it's professional or personal, whether it's organized or unorganized. Find a buddy, somebody who can emotionally purge and go, you won't believe what happened to me. Oh my gosh, I had this PBS impression tray stuck in his lower arch and we couldn't get it out and she started crying and we had to cut it out and the, and it, I oh and then all of a sudden like, well, that happened to me too. And I'm, really?
Hmm.
Yeah. And this is what I did. And really? And all of a sudden you realize you're not alone. You're not a failure. There's no character flaws. You can't walk through water and not expect to get wet. You can't be a dental assistant and it not take a toll on you. And so I want to acknowledge all the dental assistants in Dental Nation that we applaud you. You are our co-pilots. I sit knee to knee with my dental assistants and, we talk about all kinds of stuff, but I couldn't do what I do without my dental assistant. And so I acknowledge that. I applaud you guys out there. We appreciate you.
Well, and I appreciate you being on today to talk about this. I want to make sure people know how to learn more about you, maybe get in touch and kind of dive into some of those resources you may have.
So CPRs is an example of a community where you get tips, you get connection, so Leaders in Dentistry is an organization that I've initiated, and it's a community for people to feel like they're not alone, to get some skills. CPR is simple, right, Kevin?
Yeah.
But wow, it's going to be profound when it's implemented.
For sure.
And we have all the tools right in front of us. And sometimes we're 3 feet away from gold. It's one small pivot that we need to do. to make a big difference. And so my smile at drjohnson.com, info at leadersindentistry.com. You go to our website. But I'd love to connect with you guys.
And all that is going to be in the show notes, as well as the link to the podcast I did with Dr. Johnson that ran on Dr. Bicuspid that I think would be a great listen for a dental assistant out there whenever we're talking about stress, burnout, and the dentist. So, Dr. Johnson, thanks for coming on today, and thanks for your message. I really appreciate it.
Thanks, Kevin. It's been a pleasure.
And thanks to all of you who listened to this episode of the drbicuspid.com podcast. Absolutely. You matter. You're important. Your feelings matter as well. So make sure you're taking care of yourself so that you can be the leader you need to be in the practice. Till next time, it's Kevin Henry, founder of Dental Assistant Nation, signing off, and as always, wishing you nothing but success ahead.